on day one of a member becoming a new member for your health plan, how do you get them, enrolled in the right care management programs so that, you can give them the best care possible, as soon as they become one of your members. But that's going to take more work than merely, checking the payer-to-payer box. That's going to take the work of being able to stand up the API, of being able to actually use it at scale across, all different health plans, and being able to consume other health plans' FHIR data, which, is a whole other hurdle in and of itself to overcome. So I think that there's still more work ahead for us as an industry to really drive the actionability of information as it's more seamlessly exchanged. But I think too that affords us so much potential.
So I think you've been really forthcoming in terms of the complexities of making this happen and making this a reality, and that this journey for pair-to-pair data exchange does have a lot of variables to consider, that there's a lot of nuance and challenges to ahead of you. But I wanted to kind of close this conversation by giving you an opportunity to offer some advice to the health plans that are listening in. How do they lay the cornerstone for this journey? What are the proper first steps to make sure they get off on the right foot as they move along toward compliance?
I think, well, first and foremost, I hope those who are listening would be interested in joining our network of health plans that we can really help accelerate, their own connectivity across the industry, but recognize too that, that everyone is going to be taking on this journey in different ways. I would say three best practices to offer up, is really thinking about first, unlocking the efficiency and flexibility around endpoint directories. So, to be successful here, you know, you are going to need to be managing if you're not leveraging a connectivity hub like Availity or solution like Availity, all of the different health plan endpoints. And, our response to the complexities of individual health plans managing their own payer catalogs was to create a centralized directory of networked payers. So I would be thinking about how can you kind of manage, the various different health plans that you will be connecting to. I also think it's important to strike the balance between agility and standards. So, within our pair-to-pair data exchange cohort, we did embark on this journey that really illuminated the importance of striking a balance between readiness, agility, and community collaboration. So, in our journey with the initial cohort of pairs, we discovered what was required and recommended standards that were not inherently sufficient. So, at the outset, that PDEX standard had published a version 1 specification, which was only available and standard for use. There were ongoing efforts to develop a version 2, but we couldn't wait necessarily for that version 2. So we made, the collective decision early on to let's adopt that, and let's make sure as we're building with the ability to be agile and modify and adjust as we're proceeding with the build of our solution. And then the third thing is I think ensuring transparency. So, when health plans start to exchange data with each other, shortcomings may emerge due to differences between systems and data quality issues or integration challenges. So, we try to provide comprehensive reports that detail information like network size and transaction volumes and validation issue trends. That, in the absence of that too, I do think building such capabilities within a health plan itself, just to ensure that there's transparency in the information that's flowing into your system, the information that's flowing out of your system, can lead to more efficient and secure data exchange.